7,000 years ago, a person in what is now Pakistan sat still while another human drilled a hole straight into their tooth. There was no anesthesia, no metal drill, and no modern dentist chair, just a sharpened flint point spinning on a wooden bow. Archaeologists found 11 of these drilled teeth at a site called Murgar, and the holes were made with real skill, not guesswork. This single discovery rewrote what scientists believed about ancient medicine, because it proved organized dental treatment existed thousands of years before Egypt or Greece. You might assume our ancestors simply suffered through tooth pain until it killed them, gritting their teeth and hoping for the best. That assumption is almost completely wrong, and the real story is stranger and more resourceful than most people imagine. By the end of this video, you will understand exactly how ancient humans diagnosed tooth pain, what they believed caused it, and which of their remedies modern science has quietly confirmed. You will also learn why one of the oldest medical myths in human history involved an imaginary worm living inside your teeth. Tooth pain is not a modern problem invented by sugar and soda. It is one of the oldest sources of physical suffering our species has ever faced. Researchers who study ancient skeletons have found that cavities, abscesses, and worn enamel appear in human remains going back tens of thousands of years. What has changed recently is not the pain itself, but our understanding of how seriously ancient people took it, and how cleverly they responded. New archaeological digs, combined with modern chemical analysis of ancient tools, are revealing dental practices far more advanced than textbooks used to claim. Later in this video, I will explain how a 9,000-year-old filling was made from a material dentists still use small amounts of today. I will also explain why a bark chewed by Native American tribes contains a chemical now studied for actual pain relief. And I will show you why honey, of all things, played a real role in fighting the bacteria that cause tooth decay. Many people assume ancient humans had no real understanding of dental disease and simply blamed pain on curses or angry spirits. That assumption is only partly true, because while spiritual explanations existed, they often sat alongside surprisingly practical physical treatments. In ancient Sumeria, physicians believed a tiny worm burrowed into the tooth and caused decay by eating the flesh from the inside. This idea, known today as the toothworm myth, appeared independently in Sumerian, Egyptian, Chinese, and later European medical writings. Despite the wrong explanation, the treatments built around this myth were often genuinely useful, because healers still needed to physically remove infected material. Ancient Egyptian medical texts, especially one called the Ebers Papyrus, describe mixtures of herbs, minerals, and even animal dung packed directly against a painful tooth. Some of these mixtures sound bizarre today, but researchers have found that certain plant ingredients used had real antibacterial properties. Picture a healer in ancient Egypt kneeling beside a suffering patient, grinding dried herbs on a flat stone before mixing them into a paste. The healer presses this paste directly onto the swollen gum, chanting a protective phrase passed down through generations of trained physicians. The patient does not know the exact chemistry at work, but trusts a tradition that has treated pain in their family for as long as anyone can remember. But here is what most people don't realize. Some ancient dental work was not just pain relief, it was actual restorative dentistry. In Slovenia, archaeologists discovered a 6,500-year-old tooth filled with beeswax, likely to seal a painful crack in the enamel. Beeswax has natural sealing properties, and researchers believe it may have reduced pressure and pain when biting down on the damaged tooth. This is one of the earliest known examples of a dental filling anywhere in the world, long before anything resembling modern dentistry existed. Ancient Egyptians took restorative dental work even further, and archaeologists have found mummies with teeth bound together using thin strands of gold wire. These early bridges were likely used to stabilize loose teeth rather than replace missing ones, showing real anatomical understanding of how teeth connect to the jaw. There is something even stranger almost nobody talks about, and it involves a 5,300-year-old man found frozen in the Alps. Known as Otzi the Iceman, this remarkably preserved body from around 3,300 BCE showed clear signs of advanced gum disease and tooth decay. Scientists studying his remains believe his diet, rich in grains, may have contributed to cavities in a way that hunter-gatherer diets rarely caused. This single discovery helped researchers understand how the shift toward farming actually made human dental health noticeably worse in many ancient populations. Before agriculture, human diets were higher in fibrous plants and lower in sugar, which meant fewer cavities among many hunter-gatherer groups. Once societies began farming grains, sugar and starch intake rose sharply, and skeletal evidence shows a corresponding increase in tooth decay across many regions. You can see this pattern clearly when comparing pre-agricultural skeletons to those from early farming communities in the same geographic area. This connection between diet and dental disease was not fully understood by ancient people, yet many cultures still developed remarkably effective preventive habits. Across Africa, Asia, and the Middle East, people have chewed fibrous plant twigs called chewing sticks for thousands of years to clean their teeth. One of the most famous examples is the miswak, a twig from the arak tree, still used today by millions of people for oral hygiene. Modern laboratory studies have found that miswak contains natural antibacterial compounds that genuinely help reduce the bacteria responsible for plaque and decay. This means an ancient daily habit, practiced long before toothbrushes existed, holds up remarkably well under modern scientific scrutiny. Imagine a young child in an ancient village watching an elder snap a fresh twig from a tree each morning before chewing one end into soft bristles. The child copies the elder, rubbing the frayed twig gently across their teeth and gums exactly as they were taught by their parents. This simple daily ritual, repeated across countless generations, quietly protected entire communities from the dental disease that plagues so much of the modern world. There is another remedy that shows up again and again across completely unrelated ancient cultures, and that remedy is cloves. In ancient China, physicians documented the use of clove buds for toothache relief more than 2,000 years ago in early medical texts. Cloves contain a natural compound called eugenol, which numbs nerve endings and reduces inflammation when applied directly to a painful tooth. This is not folklore. Eugenol is still used in modern dentistry today, often found in temporary filling materials and numbing dental pastes. It is genuinely remarkable that ancient Chinese healers identified an effective natural anesthetic centuries before anyone understood nerves or pain chemistry. Meanwhile, on the other side of the world, Native American tribes were using an entirely different plant for the exact same purpose. The bark of a tree known as the toothache tree, or prickly ash, was chewed to numb painful gums and relieve inflammation. Researchers studying this bark have identified compounds that create a tingling numbness, offering real, measurable pain relief when applied to sensitive tissue. Two cultures, separated by oceans and thousands of years, independently discovered natural anesthetics using completely different plants from completely different continents. This kind of pattern, where unrelated cultures arrive at similar solutions, is something anthropologists call convergent cultural evolution, and it happens more often than people expect. It suggests that trial, error, and careful observation across countless generations can lead different societies toward genuinely effective medical knowledge. But here's the thing almost every documentary skips: pain relief was not always separated from spiritual practice in ancient communities. In many tribal societies, a shaman, meaning a healer who also acts as a spiritual guide, would combine physical remedies with ritual and prayer. Imagine a shaman in a small village gathering herbs at dawn, believing the timing itself influenced the medicine's power to heal the sick. Later that same day, the shaman presses the prepared herbs against a patient's swollen jaw while speaking words meant to call on protective spirits. To modern eyes, this looks purely symbolic, but the herbs themselves were often chosen specifically because they had noticeable physical effects on pain and swelling. This blending of spiritual belief and practical medicine was not confusion or ignorance. It was simply how many ancient societies organized their understanding of the body. Honey deserves special attention here, because it appears as a dental remedy across ancient Egyptian, Sumerian, and later Greek medical traditions. Modern research has confirmed that raw honey has genuine antibacterial and antimicrobial properties, capable of slowing the growth of certain harmful bacteria. Ancient healers likely noticed that wounds and infections treated with honey healed differently, even without understanding the microscopic reasons why. Applying this same logic to tooth infections and gum wounds was a reasonable, evidence-based step for the tools and knowledge available at the time. Willow bark is another example worth exploring, since it contains a natural compound called salicin, closely related to the active ingredient in modern aspirin. Ancient Egyptian and later Greek physicians used willow bark for general pain relief, including the deep, throbbing pain of a severe toothache. This means one of the world's most common modern painkillers has direct roots in remedies used for dental pain thousands of years ago. In Australia, Aboriginal communities developed their own dental traditions, using the leaves of the eucalyptus tree for pain relief and wound cleaning. Eucalyptus oil contains compounds with antiseptic properties, and researchers today still study its potential uses in oral health care. Once again, a completely separate culture, isolated from Europe, Asia, and Africa for tens of thousands of years, arrived at similarly effective plant-based solutions. This repeated pattern across isolated ancient societies raises an important question about how much of this knowledge was pure luck versus careful observation. Most anthropologists believe it was neither pure luck nor accident, but the result of countless generations quietly testing, discarding, and refining what actually worked. A remedy that failed to reduce pain or swelling would simply be forgotten, while an effective one would be remembered and passed down. This slow, generational trial and error process functioned almost like an early, informal version of scientific testing, even without any written record of experiments. When you think about it this way, ancient medical knowledge was not primitive superstition, it was accumulated evidence, tested against real human suffering. Of course, ancient dentistry also had serious limitations, and severe infections without modern antibiotics could and often did become fatal. An abscessed tooth, if left untreated, can allow infection to spread into the jaw, the bloodstream, and eventually vital organs of the body. Skeletal evidence shows that dental infections were a real and sometimes deadly threat throughout much of human history, long before modern medicine existed. This is exactly why extreme measures like drilling into a tooth, as seen at Murgar, made sense despite the pain involved in the procedure without anesthesia. Removing infected material, even through a crude and painful method, could genuinely save a person's life by stopping the spread of infection. Understanding this helps explain why ancient people were willing to endure such frightening procedures rather than simply accepting pain as inevitable. So when we look back at all of this evidence together, a clear picture starts to emerge about ancient dental care. Ancient humans understood tooth pain as a real physical problem, even when they explained its cause through myths like the toothworm. They developed genuine restorative techniques, including fillings, dental drilling, and even early bridges made from precious metal wire. They discovered plant-based painkillers, from cloves to willow bark to prickly ash, that modern chemistry has since proven to be genuinely effective. They practiced daily preventive habits, like chewing fibrous sticks, that modern dentists would recognize as legitimate oral hygiene routines even today. And across completely separate, unconnected cultures on different continents, they repeatedly arrived at strikingly similar, evidence-based solutions to the exact same problem. The next time you feel a sharp twinge in your tooth and reach for a modern painkiller, remember that this struggle connects you to thousands of years of human history. Somewhere along a dusty trade route, or beside an ancient fire, someone else once felt that same pain and searched the natural world for relief. They did not have modern chemistry, but they had patience, observation, and generations of shared knowledge passed carefully from elder to child. In many ways, that quiet, persistent human effort to reduce suffering is just as remarkable as any single ancient remedy we have discussed today. If this glimpse into ancient medical wisdom made you see something familiar in a completely new light, you are exactly who this channel is made for. Consider subscribing so you never miss the next journey into forgotten human knowledge, ancient survival skills, and the surprising wisdom of our ancestors. If you enjoyed this video, please give it a like, since it genuinely helps this kind of historical storytelling reach more curious minds like yours. And if you know someone who complains about their dentist, share this video with them, because their ancestors had it far harder.